I'll now come to order with a roll call. Mr. Landwehr, Ms. Sari, Mr. Granlund,
Here.
Mrs. Livingston Matherly,
Here.
Mr. Johnson,
Here.
and Mrs. Olson.
Here.
Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The agenda was posted throughout the district according to school board policy and special meetings according to Wisconsin state statutes. We will begin with approval of the agenda for the meeting.
Second, Mike.
We have a motion and a second to approve the agenda for this meeting. All in favor say aye. Opposed, the same. Motion carries. Before we get to agenda items 4 and 5, we would like to address the reason for this special meeting and why we are rescinding the motion made at Monday night's school board meeting. We must rescind the motion as when it was made, it was not properly noticed to the public under the state of Wisconsin open meeting laws. We are aware that this subject is very important to all of us, regardless of how it was presented. Therefore, we are holding this special meeting to discuss, clarify, and approve after discussion our COVID-19 protocol in relation to quarantining of close contact students and staff. Please note this is a one-item agenda. The board will not revisit the decisions to wear masks during summer school for those who are inside the school buildings. If you wish to speak on item number 5, you must have turned in a form to Peggy Janigo before the meeting to do so. I will recognize you and you will be asked to use the microphone. There will be no other comments or discussion on any other items beyond quarantining and relevant information. You will have up to 5 minutes to speak. Recommendations and approval for the 2021-22 school year will be made at the July 2021 school board meeting on the third Monday, July 19th, 2021. Agenda item number 4, rescind the motion from the May 10th, 2021 school board meeting to immediately allow close contact quarantine students to attend school. Do we have a second?
I'll second.
We have a motion and a second to rescind the motion from the May 10th school board meeting to immediately allow close contact quarantine students to attend school. Are there any questions or discussion?
I have one.
Mr. Landwehr.
If my understanding when we spoke yesterday, can you clarify for me exactly why we have to do this, why we have to rescind this? Because I just want to make sure that I have it in my head correctly.
Yes. You violated open meetings law by even talking about quarantining, because open meetings law requires that we post. The word quarantining is what we're going to be making a motion on. If we're going to be making a motion, we should be talking about what was posted. So now we have it properly posted today that we can have a discussion and the board can make a decision, listen to any additional information, and make whatever motion you choose to make tonight. You're rescinding because it wasn't posted as per open meetings law on Monday. Monday it was posted as summer school COVID protocol, summer school. And the et cetera isn't enough.
No, but so that's what I thought you said the other day. But my question is on it says COVID-19 safety procedures for summer school, district office, etc. But under there were 4 line items. And number 3 specifically says allow the 7-day quarantine option provided by the Douglas County Health Department for any senior that may be recognized as a close contact which a 14-day quarantine would have an impact in participation in graduation ceremonies. That is talking of quarantine. It was there, and it was not, that is not reflective of summer school. That was reflective of immediately. So the fact that I made the motion to say, instead of specifically saying seniors from 14 to 7, I said everyone to 0. It's still, they're still saying that even though we were essentially classifying seniors from 14 to 7 for this school year and effective immediately is what that would have been, that even though it was worded a little bit differently, they're still saying that that doesn't qualify. Is that accurate?
That's accurate because the attorney that we used on Tuesday after this happened on Monday night, Dan Mallon, WASB, is the one who said we should have listed the word quarantining, and we probably should have still listed it for graduation as well.
But it does say
rather than-
quarantine.
Rather than et cetera, is where that.
You mean on the actual main line
You
items?
got it. You got it.
Okay.
Yep.
I think that was detail, and what they look for the law is the agenda that was posted for the public. And
Correct.
that wasn't posted for the public.
That's true.
So, I mean, just again, and I don't want to be squeaky wheel here, but to be, so hypothetically, that being the case, because it says summer school and district office, et cetera, we have, I guess, everything on that is summer school or the district office except line item number 3. So
So we should-
technically, that shouldn't have been in there.
Or we should have posted it, graduation protocol for 2021, so that they want it as detailed as possible for the public, so the public isn't surprised of what motions end up getting made.
So let me ask this question. Had we approved all 4 of these as they were written, and would we be here today?
I can't.
I mean, I would say I don't think so.
I'd say I can't answer
Because
that.
it's not controversial. You know what I mean? That's why I'm saying it.
I don't know
just-
if graduation allowing 7 days would have been controversial or not. I don't, have the answer to that. I just know it triggered a phone call to the attorney when I ended up getting a phone call from the Bayfield County attorney
Right.
to want to be prepared prior to speaking with him. And so that's when the ask was done.
Okay. Thank you.
Any other questions or comments? Then the motion is to rescind the motion from May 10th, 2021, that said immediately allow close contact quarantine students to attend school. I will take a roll call vote. Mr. Landwehr,
No.
Ms. Sari, Mr. Granlund,
Yes?
Mrs. Livingston Matherly,
Yes.
Mr. Johnson,
No.
Mrs. Olson.
Repeat that one more time, question, please.
If the motion is to rescind, immediately allow close contact quarantine students to attend school. And your answer was?
Yeah.
Yes. And I vote yes. That motion carries. Now, approval of the COVID-19 protocol. Discussion, clarification of quarantining of close contact students and staff.
Okay. To make sure that those who filled out forms understand the procedure, those who've been specifically invited to speak on this agenda item, such as Kathy Ronke, Sarah Wortman. I have other communication from Kristen Klemmer. Kristen Klemmer is here as well. Any of the admin team, if the board wishes to ask questions of them, those would be speaking first. There can be then a motion and a second, further discussion by the board, and then the president will recognize after that every one of those who are wanting to speak. So that's the order. If Kathy, is that you? Yay, thank you for coming. I did invite Kathy on Monday. She couldn't make it then, but thank you for making it now. I have from Kristen Klemmer, Kathy Ronke said she will be at the meeting, although she did not answer my question regarding if the CDC guidance on quarantine is a recommendation or a law. But I also asked Louise Wilson, and she's from the Department of Public Instruction, and she stated we should be asking the district's legal counsel, but she added the DHS and CDC provide evidence-based guidance and recommendations to prevent and slow the spread of infection in schools, communities, etc. School districts may choose to ignore recommendations and best practices. Your local public health department may have some legal jurisdiction as they can isolate and quarantine individuals. See Wisconsin Statute 252.06. Their legal department has probably advised them on how to phrase and enforce this statute. So, without further ado, there is a microphone. Kathy, you'll be first as you cover 3 of our schools. And Sarah Wortman, Sarah, would you, there you go, Sarah. Sarah is her equivalent over in Bayfield County, will be second. Thank you, Kathy.
Hi, thanks for letting me know about the meeting. I would have come on Monday if I had had more notice. I had a prior commitment. I wasn't aware that the meeting was happening, and I certainly didn't know what the topic was. So otherwise, I would have done my best to be there. I think it's important to give the public health perspective in these complicated situations, is what I'll say. I think that what I was concerned about, the way things played out on Monday, Tuesday morning, I got an email that said quarantine ended, all the students were invited back, and there was really no plan in place. There was no, number one, I'll say, I understand quarantine and the disruption that it's causing families and children, and I have struggled with that this whole school year. I have a granddaughter that it's impacted. I've seen the struggles that my daughter's gone through with that, so I very much feel the stress of it. On the other hand, I'm also responsible as a health officer in Douglas County to put into place the strategies that are outlined by the CDC and by the state, adopted by the state. That is my role as health officer, to be that spokesperson for the state. However, being a home rule state, health officers do have some flexibility in that. And I've tried really hard across the county through this whole last year to be that sort of reducing risk versus trying to eliminate COVID. It's not going to happen. We all understand that it's going to be a long process. What can we do to reduce risk is always where I come from. So my concern with Monday, the way that things played out, that it went into effect immediately. There was no plan in place for reducing risk, no mitigation strategies outlined. Here's what it's going to look like. It's going to be classroom contacts as opposed to a household contact. What are you going to do with that? That is why I was concerned. And when I got the call, when we had our discussion on Tuesday, I was a little bit floored by all of that, because that's a pretty significant change to adopt when DPI, everything that comes from CDC and the state health department says, consult with public health, and we had not talked about this at all. And so I was a little surprised at that, actually, and that a decision was made without that information. Asking me the question about whether or not the guidance is a law, I didn't answer that in writing because it would have been a very, very lengthy email. And I've had my other casual emails end up in minutes, so I wanted to make sure that I spoke to this right. So the guidance is not a law. Guidance is the recommendation, evidence-based, as you noted. What the health department's responsibility is to make sure that policies that get put into place are evidence-based, are not going to increase risk and put our children at harm. So what can we do to work with that is what we need to have the conversation about. What could that look like with removing some of those quarantine rules for the child that's 5'11" away from the next child and that kind of thing. But also recognizing household contact, the child of the parents that are both positive, is going to be the most high-risk person to transmit into our classroom. And we're seeing cases increase across the state. Douglas County is pretty good right now, and I want to keep it that way. So I feel that sense of wanting to make sure that our numbers do stay low. I just looked at that before I came out. And in the past 10 days, we've had 62 positive cases. 10 of those were school age, and about half of those were in the Maple School District. So we've had about 5 cases in the last 10 days of children that are contagious. Now, I don't know necessarily that they go to Northwestern, but its addresses were within the district. 17 were 0 to 18 years old. 7 of them were under 5 years old, so you can assume it's little siblings. We're seeing more infants be positive. So this is still a real issue. We're not seeing a lot of hospitalizations of children, which I'm very thankful for. But what we are seeing is more cases of the variants of concern, the ones that are creating more illness. We're seeing more of that. So again, it's this balance of, if you just look at the numbers, they're pretty low, but there's still a concern because of the type of variant that we're seeing, the kids that are ending up hospitalized around the state. And as much as people are traveling and sports teams are traveling, we can't ignore what's happening down in the La Crosse area, what's happening down in St. Croix and Pierce County. And you know, our school teams, sports teams play down there. And there's no reason to think it's not going to get transmitted back. So we have to be aware. So if you're going to change a policy, we need to include in that policy monitoring cases. And what is it looking like in the county, and what's it looking like in the school district? So do we say, okay, let's not require quarantine for the non-household contacts, but they need to monitor their symptoms, and they need to stay home if they're sick, and they need to be tested, recommend testing on day 6 or 7. You know, there's things that we can put into place to assure that this is a good idea, and that it's not going to come back to bite you, and not have a huge outbreak happen, and the liability that comes with all of that. So again, I'm saying that we need to be mindful about how something like that gets planned out and put in place.
Might I ask, what exactly was shared with you on Tuesday then? Because the discussion and the motion that was on Monday was to eliminate close contact quarantine from 0 or from 14 days to 0 days. But in addition to that, we discussed keeping all the safety protocols in place in the schools. That was discussed by us. It was discussed that in the event that there is a close contact in the school, that the parents of those close contacts would be notified that your student was a close contact, and then giving those parents an opportunity to keep their kids at home for their 14 days if they so choose, as well as it was discussed that we would say, if you have any of the COVID symptoms, that you need to keep your children at home. Was any of that shared with you in that phone
I
conversation?
think we did talk a little bit about that the parents were given the option, and we did talk a little bit about that.
But we weren't pulling any of the other safety protocols out, just the one, based off of the close contact numbers that we've been provided by our district
What
nurse.
about the household contacts? That
That was not discussed, so, but that's my understanding is correct, that is a guideline or a rule, because I don't think it's a law by any means, but both Bayfield County and Douglas County are monitoring that. And I know, well, at least I had mentioned that we can't control what happens outside of here. So if the county ends up saying that if there's a close contact at home, you need to stay at home, my intent was by no means to supersede the county, or even WIA is saying that they have their own guidelines as well. It wasn't to supersede any of that. It was to just control what we could hear. So
Yeah,
I
I
guess
would say the household contact really is the highest risk of ending up positive. You know, we have a very low number, as you know, of the more casual classroom contacts ending up positive. But a household, somebody who's in the same household having that repeat exposure, That is where the risk is, so that is an important one. So I think that and I don't know what the messaging looked like to families and things, I don't know what that looked like, but.
Well, I don't think, we didn't actually write that out or do anything
Okay.
like that. I think we put that on administration and the nurse to end up coming up with
Because
that.
what I had said on our meeting yesterday was, if nothing else, that being the highest risk person would be, I think, something that really has to be followed up on, is the household contact needs to quarantine. I think that's a priority measure.
Because I believe that number was 43, is that correct? Of positive household to student or positive cases throughout the school year, is that correct? Is isolation considered a positive COVID test? So 43 is what we're talking about. Is that from your heightened concern, Mrs. Rung, is that correct? That number being 43?
Would be the highest risk of exposure, yeah.
Yeah, okay.
With an exposure, a household exposure would be the highest risk, yeah.
Okay, thank you.
Mr. Bramlin, did you have?
Well, I think, so what you're saying is the household close contacts and the in-school close contacts are way different.
They're different, yes,
And I
for
think
sure.
we were basing our decision on the in-school close contacts, and I did check, and I believe the 7 other school districts, at least one of the 7, I think it's phrased in-school close contacts.
So I think, again, with messaging with families, that would be an important distinction to make, because a close contact, we call close contacts. But for the purposes of this discussion, a household close contact is higher risk than a classroom close contact. So I don't know that everybody would understand that, so making sure that's clear in the messaging, I just think would be important.
And I think we based our decision on separating them, just on the information we got about in school, and also other schools that have this, have separated them and stayed in their lane and had in-school close contacts. It was probably, just to me, maybe more legally secure or safe.
I think that was my assumption, that we were only speaking about in-school contact, not anything out in the community or in the homes. But by all means, that needs to be made very clear. Mr. Johnson?
And Kathy, you weren't here Monday, but what we also heard was we've had over 700 kids that have been quarantined, and we've only had 1 in-school contact. That's astronomical.
Right, I don't know the exact numbers, I'm not sure where that, I'm not sure, but I do know that that is not unusual. It is something that we've been in discussions as a health officer group with the state, with the governor's office in some of these state recommendations that are out there. And this is literally the discussion we've been having for probably a month, is about needing to make some adjustments based on where we are right now. So again, I'm not surprised at the discussion. I was just surprised that a decision was made with no planning and that
Yeah,
sort
that's
of.
because we're in the school board.
Yeah.
Well, I was cut off, I think. And we're obviously, we're not in every other part of the state. We're not the county and we're not the state. But if we're going to turn over our decision-making to other government entities, well, then we might as well just not even have it.
Well, and let me clarify to Dr. Crony's question about what part of it is a law. On the public health side, and in my role as health officer, if our numbers were going up, if we had a lot of cases and you were still not quarantining, my responsibility would be to order everybody be quarantined who's exposed. So that's why it's important for us to be on the same page, because if the case numbers were different, if the hospitalization rate, if all of that was different, that's what I would have to do, is write the order. And then it would be something that's enforceable. And it's my preference not to do that, but to work with you on making these plans, putting them in place, so then if I do get a question from the state, if people report to the state that this is what the school district is doing and it's in my jurisdiction, I can say comfortably and confidently that we can do this because of this is the case rates. And the fact that you're still requiring the masking kind of makes it a lot easier for me. There are school districts that are not requiring the masking and they're going away from quarantine, and it's becoming a huge legal battle because those people are much more at risk. So whatever you believe about mask politics and all of that, all of these pieces matter, and it does impact the legal side and the orders and the enforcement and that kind of thing.
Anyone else for Kathy? Oh, go ahead.
Yeah, I have a question. And this is just for the board
You
here, and
put your mask down, it's hard.
I apologize for this, but I just want to clarify. So the discussion that we're having right now, the vote that we had to rescind, my vote was based on that we were going to get the wording right and that we were going to do it correctly as far as the family. So we will be having another vote coming. Is that?
That's
Okay,
correct.
Thank you.
So based on what you've heard as far as continuing to keep masking in the schools, continue to do the safety protocols as far as wiping things down and try to social distance as best as we can, and keep it to only in-school, close contact, quarantining, allowed to continue to come back, and have verbiage that says, if you're a close contact within your family unit, is it we recommend that you stay home
No,
and
I
quarantine?
would have to put something in place then that says that they can't be in school.
Okay,
because
okay.
Those
but-
would be the ones that are putting everybody else
No,
at risk.
okay, so I understand. So if it's worded as if you're a close contact in your family unit at home, you have to quarantine for 14 days. Based on that verbiage, what are your feelings on what we've done?
With all of those things together, the person who's been exposed, again, this is a messaging thing, so families really understand that all of this goes together. And then you can, again, confidently put out to the community, this is what we're doing, but this is how we're going to keep being safe as possible. It would be the monitoring symptoms. So if they develop symptoms, they need to stay home like you would, if they have a fever, any of those COVID symptoms, they should stay home or be tested. And if they're negative, then no problem. So you're having an assurance without the interruption of quarantine and not being in school. So in order to maintain that in-person instruction, in that 14 days, monitor your symptoms. If you get symptoms, get tested. Testing is so available right now. And in the fall, I don't know, we can talk about that later if you're going to do the testing thing here or not. I don't know. But anyway, testing is readily available right now, and it's still free. And encouraging, let's see, I got to think about it. My mind's racing faster than my mouth is talking. So the mask wearing, the social distancing, hand washing, ventilation, keep the windows open if you can. All these things still matter. COVID is still here and it's still spread the same way. So keeping all of those similar things, being tested if they get symptomatic, and the household contact needs to quarantine. And you know what, with the household contact, depending on the situation, you could do the shortened quarantine if they test negative, so there's things like that you can put in place to try to reduce the disruption.
Is it testing negative after 7 days, 6 days, 10 days? What's the
It-
recommendation from the county?
You test, and that's the CDC recommendation, is it's test on day 5 or 6. And so then on day 7, if you have a negative test after that 7th day, then you can be out of quarantine. But you need to still monitor your symptoms.
So then based on what you're saying is, if you are a close contact at home in your family unit, you need to quarantine, and on day 5 or 6, if you don't have symptoms, you can get yourself tested. And once you get results, or day 7, which I guess whichever is later, I would expect is what you're saying, the CDC county would accept that as enough to end up allowing those children back at school. Am I correct in that?
Right. The best practice would still be 14 days, and anybody you talk to and anything you look up is still going to say the 14 days is always that best practice. But it is, most kids, if they're going to develop the illness, are going to by that 7th day.
So what is the opinion of the county then on that specific item? 7 days, 14 days, 7 days
7 days would be
after a negative
acceptable
test?
for asymptomatic child
Okay, thank you.
with a negative test.
Yeah, right, I understand.
So I have a question, more of a logistical question than anything. So if we, and this would be for Kristen as well, we can keep the two separate, we can keep track, and it's doable. At home, and I'm talking about an out in the community contact versus a school contact. That won't be a problem.
Kristen, I need you to go to the microphone. We're not able to hear you.
So we would just need a little bit more detail, like an overnight stay, is that going to be considered a household contact, or is that going to be considered an in-school, like where they're not, are we going to take that as being a,
To me, in school means they were sitting in their classroom. Now, maybe somebody else will think differently, but to me, it's they're sitting in their classroom, one of their classmates has tested positive. And they were at school when that,
so we
when they
would do
found that out.
bus,
That's what I'm
The bus.
thinking,
bus
close
and
contact at
sports
school is.
and
School,
school.
bus, sports. and school.
How about the
We
rest of
would
the
be able
board? Is
to-
that what you're assuming?
That's what I was thinking. I had a few questions about like kids playing on a track team and things like that, but competing against other schools and contacting if that's a school function. So
But not the overnight stays somewhere. We're not in control of that.
we're not in control.
I have a comment too. Are we actually
Yeah,
social
mask.
distancing?
Mask.
Are we actually social distancing in school, the 6 feet? And
We
that's
don't
the-
have to do 6 feet, we do 3 feet because they're kids.
Yeah, okay.
But
And
is it 100% even at 3 feet? No, they're
no,
kids.
That's, yeah. And see there again, because I have checked on other areas, also they were showing that the spray from somebody who has contracted or has COVID does spread further than 6 feet. That's been out in the news, and a lot of professionals have stated that. So, pardon?
But the out of order. But yeah, it's okay.
These are doctors that have been speaking about it.
But that's without a mask.
Yeah,
Our
that's
kids have
without the
masks.
mask.
Without
That's where
And
they're
that's-
saying the mask is keeping things, more under control. But there again, even if we're not social distancing in the school, if 3 feet, it's hard to do. You might as well have a hoop around you with 3 feet so people can't be bumping into you or something.
Well, it's 3 feet for 15 minutes.
Right, it's true.
So
Right.
just rotate.
Obviously, we've been doing the best we can, and the
We've
fact
been
that we
very
only have one
successful.
case out of 700 is a good thing.
Been very successful here at school. Any other questions? Kristen is up there now. I don't know if you want to say something. Is she planning to-
Sure, absolutely. Kristen, is there anything more? Because
If you want to add
I was going to
something?
have Sarah go next and then Kristen go after.
Okay,
Yep.
okay, thank you.
Okay. Thank you, Kathy. Don't go away yet. There might be more questions. Sarah Wortman, Bayfield County Health Director.
Hi, thank you for the introduction and for inviting me to this evening. Bayfield County Health Department Health Officer, Health Director. I've been working in public health for over a decade. For Bayfield County, about 200 students fall in the Maple School District. So we have the Iron River Elementary School in Bayfield County, and then some Bayfield County residents, of course, go to the middle and high school. What we do at Bayfield County may be slightly different from Douglas, or I may have different opinions, and that's the value of home ruled state, right? So just take that with a grain of salt. Currently in Bayfield County, we are still adhering to the 14-day quarantine, and here's why. Because we are still getting people sick on day 16 and day 13, and we are having that documented, and there is spread in schools. And I'm busy working every day because we have 2 outbreaks in 2 different schools currently. Most of it is spread in family units. So like Kathy said, if mom has COVID and she's positive and, she hugs kid, every mom hugs their kids. Of course we do. That's how it's being spread mostly. But we are seeing documented cases of it being spread in schools, particularly in athletics. Because you can't really socially distance in soccer and other competitive sports. So we do have documented cases. With your statistic that you keep citing about 4 people out of 700 or 1 case out of 700, it's possibly unreliable data. And here's why. The information, when you put it into WEDS, Wisconsin Electronic Disease Surveillance System, was hard to keep up with charting in October, November, December, January, because we were getting 20 to 50 cases a day. And if you didn't check a box or link a case from mom to the son in WEDS, it wouldn't be documented as contagious in the household, contagious linked to school. And because we were completely overwhelmed in public health, we called upon schools to help us out. And they did a great job. But the data is only as good as what's put in under an extreme crisis condition. So I just want you to use that data with caution. So that's just one of my opinions, and you have the right to have your own. But we still stick with the 14-day quarantine in Bayfield County, and here's why. The CDC website is still recommending it. And if you scroll down on their website under other options, that was added in the spring because of non-compliance, essentially. The CDC caved, said, no one's following this anyway, so let's just do a shortened quarantine to get people to comply. But the gold standard, if you had a different choice for cancer of, well, this is good enough, or the gold standard of cancer treatment, which one would you want? Which one would you want for your loved one? And that's why we're sticking to the 14-day. Now, everybody's different. We have working parents. We have a lot of people who have to travel to work, and virtual is not a good option, and I understand that. And similar to what Kathy said, we can look at options where if the 4th grade had a positive student and the student was in the back of the class, do we really need to send all of 4th grade home, or just those immediately in closest contact? And I think that there is flexibility in that at the local level. But the decisions about who should stay home or who should go to school should be with public health. Chapter 252 of state statutes in Wisconsin is the communicable disease state statute. And the authority, responsibility remains with the health officer and the health department for communicable diseases. During this pandemic, we called on schools to help us out, but that's not your traditional role. That was an emergency situation. That's Katrina. This is what it was. But as far as your plan on if people should quarantine or not, that's not really your decision. The decision is with the health department to make those recommendations. Oh, you know what? You sat in the front class 5 chairs up from Susie. You don't have to quarantine. You can go back to class immediately, starting tomorrow. Those are the things that we do through a thorough investigation and interview with families when we find out about a new positive case.
Okay, Kristen,
That's not Kristen.
no, I
That's
know,
Sarah.
but the one positive case that we have of student-to-student contact, do you know when that occurred, in what month? Which one? January. Okay, so you said the numbers that we don't have aren't, I forgot the word.
Reliable data.
Reliable data. So what we do have is January through May 6th of this year within our district, 452 number of quarantined students. I think that's actually students and staff. Just students, okay? And we've had 1 student-to-student positive case out of those 452. That's the numbers that we've been provided. So those numbers seem pretty accurate to me.
One of the problems with that is that in northern Wisconsin and across Wisconsin in general, people weren't getting tests we are smart people up here, and we know that if we want our children to go back to school and they have a runny nose, if I don't get them a test and I give them, give them extra fluids, some emergency, send them to class. You can't guarantee that all of those students who were sent home to be in quarantine were tested at day 1, day 7, and day 14, because parents, we aren't testing them periodically through their quarantine. So they could have had symptoms like a sore throat, mild cough that they had at home when they were in quarantine, and they never got a test. That is why it's not necessarily reliable data.
But it's what
Okay.
we have. And if it were 20 times more, it still would only be 20 kids.
But at the same, I guess we've had 53 then, total positive cases for students from June to May 6th. I mean, are those numbers not accurate either? No, I'm asking you, because you're saying that our numbers aren't correct.
No, I'm saying that there is a good chance that your numbers don't really state how much spread there is in a school setting when a large amount of cases go underdiagnosed.
Okay, so the fact that Mrs. Ronke said that the CDC recommends, maybe not recommends, is willing to accept 7 days being tested on day 5 or 6 with a negative test on day 7 to come back, you're saying that your recommendation is not to accept what the CDC is saying. Is that accurate?
No, you're misleading that information. The CDC promotes 14 days of quarantine as the gold standard. That is what we accept in Bayfield County. We do make allowances if a child has no symptoms, is compliant with reporting, which is twice daily symptom monitoring, and they have a negative test on day 5, 6, or 7, then yes, they could go back. So we will make exceptions, but our preferred standard is 14 days.
So if we have a student that tests positive and you do your monitoring twice daily, and on day 5, 6, or 7 with a negative test, you're saying that at that point, it would be acceptable for that student to return to school. Am I hearing that correctly?
So they would go back on day 8, I believe.
Well, you said day 5, 6, or 7.
So they would get the test on day 5, 6, or 7. They would go back if it's negative on day 8. And in Bayfield County, we require a PCR test.
Okay, and Kathy, you just shook your head. Are you saying day 8 is when they could return? After December, so day 8. Okay, thank you.
I have a question. I just want to clarify what I heard, what I think I heard you say. You said that the decision is not yours to make, you're addressing us. And you said, we, meaning the county, make the recommendation. Did you not say the recommendation?
So what I mean by that is the school board, you can modify your plan. You can add to your COVID-19 prevention plan that someone spent hours and hours on last summer and beefed up to help protect your students. So you can absolutely modify your plan. But as far as telling a student whose parent is positive that they can come back to school, that's not under your authority as a non-medical provider and non-health officer to do.
But you said that we, meaning the county, make the recommendation. You didn't say law. You said the
So-
recommendation.
So at Bayfield County Health Department, what we do when we do an initial interview is find out who all was exposed, and then we start contact tracing. So we've heard a lot about contact tracing on the news. When we do contact tracing, we typically advise the person. We say, you need to stay home and self-isolate to make sure that you aren't sick, or self-quarantine to make sure you're not sick.
So you're advising them, though.
So, and if they refuse, then we issue public health orders. And so that is an order by the local health officer, which is me in Bayfield County and Kathy in Douglas. Then I issue an order to state, Susie Q, I'm sorry, but your mother is sick and you now have a sniffly nose and a hacking cough. You need to stay home. And so, yes, we do issue quarantine and isolation orders. And so that is something under the responsibility of the health department.
So was there an ordinance on that? Or just a,
The Bayfield County has an ordinance stating that if there is a health officer order, a public health order in place, that it's enforceable. So in Bayfield County, The ordinance doesn't state that they need to quarantine. The order states that if I have an order and someone violates it, that it's enforceable by fine.
It empowers you then, and that's different than Douglas County. Yeah, thanks.
Any other questions?
I just want to clarify, it's the statutory authority is not different. Every health officer in every county across the state has that authority. In Douglas County, we prefer compliance through our recommendations, working with the schools, talking with the parents and things like that. We don't go to orders first. We leave that, and because it's a big deal. It is a law. There are fines that are attached to it, and we have chosen, because everybody's hands have been so full, we have chosen to go by the compliance versus the order. We haven't needed to because people have, I think everybody's been kind of on the same page with, we want to be over and through this. People are mad, they don't like it, but they have been compliant for the most part. So I have not issued orders. I haven't needed to at this point. And I don't want to. I will if I have to, but I would prefer not to.
Thank you. All right. Any other comments, questions?
Is it time now for Kristen?
I believe so.
Okay. Kristen, could you please share with the board?
So I follow the recommendations that we are given from our local public health departments and the DHS. So whatever, we need to be doing, I will do. But if we do choose to do the shorter quarantines or whatever, or no quarantines, our health support would need, our health officers would need the support to be able to do that. So I would just be asking for more hours for the nurse, maybe in Iron River too, because she would just need more time to, because there's only 6 hours of nursing over at Iron River School. And then also we have the rest of the offices that could use assistance if we choose to do more tracking and stuff, so we have more accurate numbers.
Any questions for Kristen?
I don't have any questions, I don't think, for Kristen, but we don't have to make a motion on allowing more time for what she's asking for as far
We
as
would
paid
do
time,
what we
right?
need to do.
We do?
We will do what she
Oh,
needs.
yeah, okay. That's,
She's done with her presentation? We can ask her.
Yes, is there anything more, Kristen?
No?
I just wanted to say happy school nurse day, Kristen.
Thank you.
Nothing says we appreciate you by making you stay longer. Thank you.
That's just what I want to say is the public health nurses and our school nurse, it's been a tough year, and we do appreciate the work you do, whether or not we're going to agree with everything you say or do, but we do appreciate all the effort that's gone into this during this pandemic. So thank you for that.
I agree. Thank you.
Now it's time then
Thank
to
you.
listen to our public.
I think we
I
need
thought we'd make a motion first, don't we?
You can, yes.
So can I make a
Yep.
motion?
Sorry.
All right, this might be lengthy, Peggy, I apologize. Okay. So I make a motion to, and I'm going to look at the county nurses at the same time to make sure you nod your heads to make sure I'm saying this correctly. I make a motion to end close contact quarantining while in school. If you are outside of school and you have a close contact in your family unit, you have to follow the county guidelines, which are quarantine at home, be tested on day 5, 6, or 7. With a negative test, you can return to school on day 8, unless you have symptoms. Is that correct? Both of you shake your head, all right. Sure, I'm pausing my motion.
I'm sorry, I never get these rules right for the formal meeting. So, but there's a second option in there for 10 days with no testing, asymptomatic. CDC permitted.
So can I say,
quarantine.
and/or 10 days with no test?
Correct.
Does Bayfield County agree with it, said thing?
And that's asymptomatic.
Yeah, right, with no symptoms.
You had that in your packet on Monday. Yes.
Right.
Can I just suggest one word change? You put, your family unit, should it say a family unit in case they're having a sleepover with,
Should it say a family unit or your family unit?
because what do you do about sleepovers?
A family unit.
So I want to understand. So a family unit, that means that takes care of the sleepover thing?
I think so.
Thank you. What, Peg? I can't hear you. Yeah.
You're not done yet, are you?
No, I think he's done.
And then, I think I'm done.
I think he done.
I end my motion.
Well, then I want it repeated.
Oh,
I have a suggestion. Do we have to add additional protocol? And if we do, does that have to be part of the motion? Like we'll have do we already have the tracing and,
right, but I think
In
you covered
place.
it.
I covered the county asks and wants, and I covered, I guess, my asks
And he
and wants.
covered the lessened amount of time rather than the 14 days.
Right, so,
And he covered sleepovers kind of concept here.
I need to hear it over.
all right.
Okay, Peggy will,
Mrs. Janigal will read it for us again.
You want a microphone?
yeah, she needs a microphone.
All right. And I write in partial words, so you'll just have to bear with me. Motion to end close contact quarantining while in school. Outside of school and close contact on a family unit. And this is how I write, but I'm covering all your stuff. Quarantining at home, you have to be tested days 5, 6, and 7 with negative result, return in 8 days. Unless you have symptoms, you may return after 10 days with no symptoms
And no test.
and no
No
test.
test.
Kathy's got a question.
Can I
Can
say-
I just add one more suggestion to a caveat of this can be revisited if there's an outbreak or sudden increase in
That's
numbers or
right.
something like that, that it could be revisited?
I think we always, all along, we've said that. We have to keep looking at what the numbers are, where we stand, and revisit. So I think that's kind of assumed.
Do I have to say again, effective immediately? Does that need to be said? Or is
Say
it
it.
assumed that it
Yeah, put it in
happens, or it's still there, I guess?
So in effect, you're saying we're still dropping it to 0. You're still in effect saying we're still dropping the quarantine to 0 if it's in school.
Or if it's at school,
school.
Yes,
or
at
the
school,
bus.
right.
At school, right.
So we have the motion. I think it's been repeated now. Are we ready to second the motion?
I will second the motion.
All right, we have a motion and a second. And I think at this time, I will call on the people who have asked to speak.
Unless there's more discussion here
Any
first
more
before we.
discussion here first?
can we discuss after they speak?
We can.
You can, but generally you discuss first before you invite those from the audience in. So you have a chance to say all your points and then they get to speak.
Okay, it includes in school or at school functions,
To get that clarified, let's get that clarified.
at school functions.
I guess my opinion of in school is any school activity. So whether that's FCA before school, whether that's, if it happens under the school's watch,
Okay, so
maybe
that
that's
would mean
more-
at sports.
at school, sports, whatever it ends up
Okay.
being,
Okay,
that's what you've got.
okay. That's what, that, I appreciate that, because again, this is all about clarity, and it helps us to implement whatever it is that you are asking us.
Although, do we have to say that we have, we don't have, I don't think we have to say that we have to follow WIA guidelines because they're already in
Those
place.
already are guidelines, 'cause-
That they have to be followed.
but the guidelines for WIAA are whatever the board says for in season. Because I got an email from Diane Tremblay, superintendent from Barron, asking the Heart of the North superintendents, will you still play us if we ended up getting rid of quarantine? Because they wouldn't do that if some districts won't play them. They want to know that. Their board wants to know it before they make a motion such as
And what was the
that.
response to that?
The WIAA tournament was what you got, the information about WIA tournament is different than in season. I don't have all of her data. She just emailed us. I haven't even been able to respond to her. I mean, this stuff has happened pretty quickly.
Any further discussion before I ask these people forward? All right, just a reminder, you have up to 5 minutes, and we're only speaking to what's on the agenda, which is quarantine. First, I have Judith.
Hi, I'm Judith Cheney. I'm from Brule. I was very excited and pleased the other night when you made that motion and it carried through. So then it was a little to hear that this was happening again. I'm like, oh my gosh, what's going on? But my biggest fear, and I also want to state, we chose to homeschool our children this year. We're doing it under the school's umbrella. But so I don't actually have kids in school right now. So part of me is like worried that this will set precedent for fall if we continue this quarantine, and that's one more roadblock for me to getting my kids back in school where they want to be. We love this district. We love our teachers. We want to be in school. And we can't because all these extra, and I know they're for safety, but our numbers don't add up to me. But so then I'm still trying to teach 5 kids at school or at home. And I'd love them to be back in the fall. So I'm really hoping that this motion passes. But another big worry is our seniors. They have worked hard, not just this year, but for the past 13 years. They have had 13 years of school, and it just honestly breaks my heart to think that because they sat 6 feet from somebody who they don't hang out with, who they don't talk to, but they happen to be in chemistry with, that they would miss their graduation even though they are perfectly well. That to me does not seem like we're treating these seniors right if we say that you don't get to go to your own graduation even though by all symptoms you are completely a healthy child. I liked when we talked the other night and talking about you treat it like a strep throat case. You get a notice saying somebody in your child's classroom has this. Watch out for these symptoms. If you have any of them, please keep your child home, get them tested, etc. That seems like a good compromise instead of wiping out a 6-foot radius on every single classroom in the buses. We give the choice back to the parents. Parents get to still be responsible. School can't take over every choice. Parents are still responsible, and they need to step up and take these responsibilities. If you're not comfortable, of course you can keep your child home. If you're comfortable, send them back. But if they develop anything, obviously keep them at home, which they should do every single year anyways, because you should never send a sick kid to school, no matter if it's COVID or the flu. It was my understanding that the motion never had anything to do with outside cases, that it only had to do with things that happen under the school's umbrella. So that was confusing too, to just well, of course, the school can't police everyone's home, obviously. We can't say who goes where and who does what. We keep track of what happens in our buildings and at our facilities. And I know when we're looking at, it's a lot of numbers for the state, for the county, for the country, but we're one district and we worry about our district. And I know we take, samples of everywhere else, but we need to do what's best for our district. What's best for our district and what best practices work for us don't work for Milwaukee, don't work for La Crosse. We're not them, they're not us. So So that when we're looking into these best practices, we're looking at what's best practices for the children of Maple School District. And this has been a very tough year. I don't envy you guys, your jobs, and what you have to do and the decisions you have to make. I know it seems like, well, if we don't do this, this group's gonna be mad at us, and if we don't do this, that group's gonna be mad at us. But for these kids, we need to be thinking about what's best for the kids. And I really don't think our numbers support why we've had quarantined 700 healthy children, and with one confirmed, you got this at school. Maybe I'm missing something, but that does not make sense to me. That's about all I have. Thank you very much for your time.
Thank you. Next is Misty.
Hello again. So like I said on Monday, I have 4 kids that are going to be here in this district. One is not old enough yet. And I just want to thank you guys for what you're doing. I think that for the most part, the majority of you guys are for our kids, and you're fighting for our kids just as much as us parents. But I just want to remind you that there is a vaccine out there that every adult is able to get to combat or to help themselves feel more confident in going out in public or coming to school or having their children come home from school. Every single adult is able to get that vaccine. So I don't feel like these quarantine guidelines still need to be in place if we have a vaccine that's out there available for every single person. So I think that needs to be looked at. Also, I just want to ask, who's advocating for these children's mental health? My daughter spent an entire day crying the day that she got quarantined because a child who is half her age, who was sitting halfway up the bus, tested positive. She never even talks to these children. She doesn't know who they are, but yet they made her miss out on games and miss out on going to school. Her grades are already suffering, as well as many other children in the high school and middle school and wherever. But I'm specifically talking about my daughter in high school right now. There is a lot of children whose grades are completely suffering because they're stuck home for 14 days at a time, and then they go back for a couple days and then possibly quarantined again. And this is just not fair for our children. And I really need you guys to hear me. Someone needs to stand up for their mental health. It's not just about who is going to get COVID when this child comes home. Because if someone was completely worried about getting COVID, they need to be the ones staying home. Because these kids need to be in school full time. Not on and off. That's not okay. It's not fair to them. My daughter's 15 years old. She doesn't cry about anything, but when she is crying about something, it means that these things are affecting our children. There's many other children, friends of mine, that their kids have never once in their life suffered from depression or mental health issues, and now they are. Why is that? You guys need to look at the policies that you're putting in place, because I'm pretty sure that has a lot to do with what you're doing to our children. The policies that the health department or the school nurse or whoever is helping to put into place, they don't add up. Our numbers are low. Let's let our kids live their life. And like I said, I'm not yelling at you. I know my voice is raised, and that's just because I'm really frustrated about the whole situation. I should be home in my garden right now. I appreciate all of you that are standing up for our kids up there. So thank you.
Thank you. Next is Mahela. Say that right? Okay.
My name's Mahela. I'm actually Northwestern alumni. I have a master's degree in public health and tropical medicine. I'm starting medical school this fall. I know that this whole COVID thing has been really frustrating. I've worked in infectious disease for a while. But I know that people thought maybe a 16-day quarantine from school acquired infections was too much. Okay, but I don't think getting rid of quarantine altogether from any sourced infection is really appropriate. I think the motion to maybe end quarantine for school-acquired or possible school-acquired, contact versus, but still keeping the quarantine for, cases that were acquired in the community or maybe from families or in homes in general, just like whether you were at a sleepover for the weekend or whatever. In any home setting, the risk is very, very different from getting exposed at school. And I also want to bring up the fact that we really don't know that much about coronavirus, this coronavirus in particular, nCoV-19. This is not strep throat. Strep throat is a bacterial infection. Viral infections are very different and they affect children very different. We know that there can be really serious long-term effects from certain viral infections. We know now, we didn't know years ago, that the chickenpox virus can cause shingles later in life. We know now that the measles virus can wipe a child's immune system and make them more susceptible to infections even years later. We really don't know much about the long-term effects of COVID, and I really think that we should all choose to be safe rather than sorry. I know that our numbers seem relatively low, but again, these numbers are always an underestimate. We really don't know how many cases haven't been reported, how many people spread this infection unknowingly. I know that parents would never send a visibly sick kid to school, at least most parents, but the problem with this virus and most viral infections is that you don't have to be visibly sick to spread it. It's very easily to unknowingly spread viral infections. And if all that it's going to take is a couple weeks at home or wearing a mask or getting a vaccine, I really think that that is a small sacrifice to make when we're talking about kids' lives. I mean, kids have died from this. This is a serious thing. This is not, this isn't a common cold. This is really serious and we need to be proactive. And the reason that our numbers are so low is because we've adhered to the expert advice. So our numbers are low. As soon as we stop doing that, I think that we are on the tail end of this. The vaccine rollout's been going really well, and I think we should continuously reassess this as a community with the school board at the end of the summer, see what the vaccination rates look like, see what the case rates and infection rates look like, and decide from there, if we really think that quarantining is still necessary, et cetera. But this vaccine hasn't been available to the public for very long. People are still, even people who want to get vaccinated and plan to get vaccinated, not everyone has had a chance to. So I think that it's still too early for us to say, well, it's over, let's just move on with our lives. I mean, people are still dying from this every day. I live in New Orleans, where I live now in New Orleans, I'm from here. My sister still goes to this school, but we had to convert our convention center to a COVID overflow. I mean, I've seen the patients. I've seen the doctors who spend hours and hours trying to save these. I mean, kids are not immune to this. And kids can still spread it to their parents and grandparents. This is really serious. And I'm really sorry that it's hard on the kids. I know that it's hard, but this is more important their lives are more important right now. And that's what matters. And again, we can reassess this in a few months, but right now it's just simply too early. And that's my opinion. Thank you.
Thank you. I have Chad.
Smarter than I am in this room because, going on your point, are automobiles dangerous? Would you ever consider having people sit at home because it's too dangerous to get in an automobile? 17 years of my life I gave to a business that's now gone. 17 years. You guys sit on that school board and you're not considering one bit of mental health, the mental health impact that this and the decisions you're making are having on our kids and our community. The mental health, how do you gauge that? How? How does that play into your decision making? How does it? Where does mental health weigh against COVID and COVID numbers? Where? You come up here and tell me your data is not accurate. Now you're influencing my life, my kids, because you have inaccurate data? I can tell you the accurate data. My mental health of my children has fallen off a cliff. A cliff. My personal mental health, fallen off a cliff. For what? Because you don't have accurate data. Again, I'm glad there's a lot of people that are smarter than I am in this room and making decisions. Because the way I look at it, I'm not smart. I just know the reality of the situation.
Jennifer?
So my kids kind of wanted to be here today. They had a few things they wanted to say to you guys and stuff, but they're a little shy. But they wanted you to know, like, basically, it breaks their heart. They, being quarantined for them, it's not working. My kids' grades are slipping. Their principal can attest to that. I get truancy letters for missing school, but you don't want to call the school and say, hey, my kid just doesn't feel like coming to school today because immediately it's going to be COVID. And then not only that, but you're saying like, oh, okay, well, go get tested right away. But then you're exposing your kid to COVID when they more than likely don't have it. I have a friend that called me today, and she is a nurse. Her and her husband are both tested positive with the COVID. Their kids did not. Kids had 2 negative test results. 2, they're not allowed to come back to school. Why is that? Because, they're suffering. Her son did not do well today. I've had people call me several times today to say, look, my kids aren't doing well. I can't be there. Can you please say something? There's no reason to quarantine a healthy child. There just absolutely is none. I have a comment that says, if you believe that quarantine is still necessary, will you require a 14-day quarantine of your family member traveling right now, forcing them to miss graduation? So, so you just want the answer to it? If you believe that quarantine is still necessary, will you require a 14-day quarantine of your family member traveling right now, forcing them to miss graduation? And also, you live in New Orleans, is that what you said? Because this is Maple School District. This isn't New Orleans. I understand you're alumni, but right now you don't have a student in this district and you don't live here.
Listen,
have
we're not,
say?
excuse me,
don't think so.
we're not having a discussion between you two. You're talking
I'm
to,
making
you
a
are talking
statement.
to us, please.
She's talking to me, so I'm making a
No,
statement.
no,
so-
you need to stop.
Well,
We are, if you want to talk later, that's fine, but you are speaking to us now. We're not having a discussion between members in the audience. That's
okay.
out of order.
So we are talking best practices. Best practices are, okay, never mind, sorry. So, and we want to talk about quarantine, then we need to quarantine across the board. And when kids are sick at school, we need to send them home. And there are instances of that not happening. So if we're going to talk about quarantining these kids forever, then we can't be not following, you have to follow your own rules. That's what I'm saying. And and when we talk about evidence-based, we need to use our district's evidence-based, not others, which I kind of think has been covered. And I'm not really good at this, so I'm sure there's a lot that I'm missing, and I'm sure there's many other people that were going to talk tonight, so hopefully they cover what I missed, but quarantine's not working. It's not for anybody. Mental health, grades, teachers, parents, nobody. Businesses, it's got to be different. We got to do better.
And Katie. Katie Johnson? Oh, yeah, it looks like it. So, thank you, everyone. Board, are there any more questions, comments before we vote?
I do have something, if Well, first of all, everyone up here does care about the students, and that's why they're here, not just the people who voted the way the, parties wanted them to. And we do, I've been on here 11 years, and I know for me, and I know everybody else, we appreciate our great teachers, our paras, I wrote the list down here, our office staff, our custodians, our volunteers, our bus drivers, our food service, our admin team, our middle management, our coaches, advisors, substitute teachers, school nurse, county health nurses, and everybody else that I maybe have forgotten, school board members. And that being said, the kids come first. And I think, I also appreciate all the input we had the last 24 hours probably from people I've gotten. We've all had emails, texts, phone calls, both sides of the issue, and had an excellent letter from Mr. Bates. I think everyone got that, who couldn't be here tonight. But the kids do come first, and one of the speakers here mentioned mental health, and the mental health is an issue, definitely. And also, the education has suffered. 742 quarantines equals 7,420 days, 10 days. They're 14-day quarantines, but there's weekends, so we're not going to 6 days, 6 days a week school or 7 yet. But anyway, the kids come first, so I think, I agree with the motion that was made and seconded, and I feel that's what we should do.
Anyone else? I'd just like to say I appreciate all of the clarification that was done here at this meeting tonight. And I want to publicly say that I regret the word immediately that we put in our motion on Monday, because it did not give our administration, our principals, our the one that takes care of our bus director, time to and time for families to be notified in a proper way. So I apologize for my part of that, and I learned, and I know that next time I will be more aware that things can't happen sometimes as quickly as we would like them to happen. But I do believe that looking at our data and continuing with all of our other protocols, with the number of staff that has been vaccinated, that we can move to the no quarantine in the school, as stated in the motion.
Did the motion say in-school close contact? That's what I'd like to know. Okay.
I don't know if that's the exact wording, but do we need to hear it one more time? Okay.
Thank you.
It includes quite a lot, so I think it would bear repeating one more time if you don't mind, Mrs. Janigal.
Mr. Johnson, would you be so kind as to take your microphone and give it to Ms. Janigo, even though she doesn't want you to?
And it will be fragmented because that's exactly how it's written. But Mr. Landwehr made the motion to end the close contact quarantine of students that are declared for close quarantine in school. Outside and close contact in a family unit is not included. Quarantining at home, you need to be tested on days 5, 6, or 7. And with a negative test on either of those days, you can return on day 8 unless you have symptoms. And if you don't get tested, you can return on day 10. Yeah.
My understanding with the motion was that when it was said in school, it means also including activities under the school's supervision. School sports, school activities.
It's kind of the school umbrella.
Correct, the school umbrella. Just for clarification of implementation. I'd appreciate that if that's okay. Yeah.
All right.
Sherry has a question.
I just want to agree with Mr. Granlund, and I'm happy that the clarification with the family unit was put in the wording. That makes me more comfortable. But I think all of us sitting here all care about kids. That's why we're here. And we may not vote the same tonight, but we're all voting with our own opinion of what is best for kids in the way that we are voting. So yes, we do have the kids' best interest in mind.
I believe then we are ready to take a roll call vote. Mr. Landwehr,
Absolutely, yes.
Mrs. Sari,
And this will be reviewed as needed, correct?
Correct.
Do we have to have that to the motion as well?
We've been doing
Okay,
that
that's
all
good.
the way along.
I will agree to it
okay.
at this time.
Mr. Granlund,
Yes?
Mrs. Livingston Matherly,
Yes.
Mr. Johnson,
Yes.
Mrs. Olson,
Yes.
and I vote yes. And now I would look for a motion to adjourn.
I make that motion to adjourn.
All in favor, say aye.
Aye.
Opposed, the same sign.